Okay. Hello, everyone. My name is Lebogang, and I'll be presenting my project overview titled Investigating the Effect of Combination Therapy in Oesophageal Squamous Cell Carcinoma, abbreviated to OSCC. That is the cancer of the esophagus, and this cancer is the 9th most common cancer and the 6th death-causing cancer type worldwide. There are 2 subtypes of esophageal cancer, namely the adenocarcinoma and OSCC. Studies have shown esophageal cancer cases are attributed to OSCC, and as of 2018, Africa had the 2nd highest OSCC incidence rate worldwide. This figure
Lebogang?
Hello?
Hi, sorry. We lost you for a moment there.
Where should I start?
Just at the beginning of the slide will be.
Okay.
Okay.
Fine now, can you hear me?
Yes, we can hear you.
Okay. So esophageal cancer is the cancer of the esophagus, and this cancer is the 9th most common cancer and the 6th death-causing cancer type worldwide. There are 2 subtypes of esophageal cancer, namely the adenocarcinoma and esophageal squamous cell carcinoma, which is OSCC. Studies have shown that about 90% of esophageal cancer cases are attributed to OSCC, and as of 2018, Sub-Saharan Africa had the 2nd highest OSCC incidence rate worldwide. This figure shows the age standardized incidence rate for esophageal cancer categorized by sex and geographical location. Also, OSCC is high in males. The blue shows males and the red represents females. OSCC affects the epithelial cells in the upper 2/3 of the esophagus, and it has a survival rate of less than 5 years, as it is already at the advanced stage by the time of diagnosis. It is caused by excessive alcohol consumption, smoking, genetic predisposition, and nutritional deficiencies. Some of the symptoms of OSCC include coughing, chest pains, weight loss, and difficulty in swallowing. The treatment of OSCC is dependent on the cancer stage, and these treatments include surgery, radiotherapy, the use of chemotherapeutic drugs such as 5-FU, paclitaxel, cisplatin, and oxaliplatin. Cisplatin and 5-FU are the most commonly used in developing countries due to their affordability. Sadly, these 2 are associated with poor efficacy, chemoresistance, and chemotoxicity. Therefore, this calls for a need for the development of new efficacious and affordable treatments. The mechanism of action of 5-FU is attributed to its 3 metabolites, namely the FDUMP, which inhibits thymidylate synthase activity needed for DNA synthesis, the FDUTP, which replaces the DTTP pools in the DNA, causing DNA strand breaks, and incorporated into RNA in place of UTP, resulting in unusual RNA processing. FDUMP and FUTP results in DNA-directed cytotoxicity, whereas FUTP results in RNA-directed cytotoxicity. Of thymidylate synthase is the primary mechanism of action of 5-FU, and this inhibition prevents DTMP synthesis, resulting in the imbalance of DNTP pools. DTMP synthesis is important for DNA synthesis, and the imbalance of DNTP pools disturbs DNA synthesis and repair, resulting in DNA damage. What we'll be looking at in this study is gemcitabine, which is used to treat non-small cell lung cancer and pancreatic cancer. So gemcitabine is active as a prodrug that is activated upon entering cells via phosphorylation by the deoxycytidine kinase into gemcitabine triphosphate. The active antimetabolite leads to the inhibition of DNA and RNA synthesis, resulting in inhibition of DNA and RNA polymerases. Studies have shown gemcitabine to be a promising cytotoxic agent for treating various cancer types such as OSCC. So another drug that we'll be looking at in this study is metformin, which is used for the treatment of type 2 diabetes. And metformin has shown to have anti-cancer effects in cells and animal models, and is also currently tested in clinical trials. Studies have shown that metformin decreases the risk of liver colorectal, blood, pancreatic, and lung cancer. Studies done in our lab using the South African-derived OSCC cell lines have shown that metformin decreases and also reduces the OSCC tumor size in edema models. This study is to investigate the modification in the mechanisms of action, including the levels of DCK and TS in tumors extracted from OSCC treated with 5-FU and gemcitabine in combination with metformin in comparison to the monotherapies. And the reason why we are also checking the expression of P53 is because the mechanisms of action of 5-fluorouracil, gemcitabine, and metformin all activate P53 for apoptosis. So what we are going to do in this study is that we are going to use the tumors extracted from the OSCC mouse xenograft to analyze the levels of expression of P53, DCK, and TS using immunohistochemistry. And this is the protocol immunohistochemistry and also using Western blot. This is our protocol for Western blot. So what we hypothesized in this study is that we are going to have different levels of expression of P53, DCK, and TS in the monotherapeutic treatments compared to combination therapy. And this study is important in clinical perspective because diabetes is a huge problem in South Africa and the world at large. Therefore, it is important to understand what causes the resistance in these combination therapies, as this will guide to how to treat patients who need OSCC treatments, but at the same time are on metformin for diabetic treatment. So what to take away from this study is that it is important to understand the mechanisms of action of drugs before suggesting them for combination therapy. These are my references, and thank you.
Thank you very much, Lebogang.